I was like, either nobody's going to show up or it's going to be full, because this is just a touchy subject, you know, but I also think it's worth talking about. So I was really grateful that the Turnpaughs allowed me to give a talk on it. So basically, what I've discovered is that I should give a talk on whatever I'm actually the most interested in. Whatever topic I actually want to research, because that's whenever I usually learn the most, I'm able to relate the best information. And right now, my entire world is kind of obsessed with the world of addiction, and what that means, what that looks like, what's the path, that sort of thing. So this past year, my family, like many other families, was in crisis because there was a loved one who was struggling with dual diagnosis, so that means psychiatric-induced psychiatric mental health issues induced by a substance of some kind. And we attempted to try to have that person stay with us. It ended in disaster. And we were just trying to figure out where to go from here. Where do you send someone who's struggling with these different components? And both my husband and I, independent of each other, had this thought the same day, like, maybe we should open up a sober living home. And whenever, you know, you both have the thought independent of each other, it just really feels like God's talking to you and kind of like giving you a message. So we went with it. Everyone kind of thought we were crazy and tried talking us out of it. And maybe we were, who knows, but you know, that was back in November, and by March this past year we had a full house, and we're licensed with the state of Pennsylvania as a sober living home, and we have a waiting list of 30 guys. So it's going, you know, it's really interesting. I'm not going to say it's easy, but we're enjoying it, and we are learning a lot from it. And I share all that, you know, I'm not going to stand up here and say I'm an expert in addiction. I definitely would not qualify myself in that, but I definitely am in this world right now. I'm learning as much as I can, as fast as I can. And, you know, we have a slightly different look at this because, you know, I'm a naturopathic doctor. I've been working here for 6 years. And my husband owned a gym for 7 years, so he's a physical trainer. And he actually struggled with addiction before we met too. And really what helped him was his obsession with powerlifting, and he shifted his addict energy into becoming a power lifter. So he'll be here at one point, but and so that really kind of thought, okay, how could we potentially do this differently than what is out there? So that is kind of what spurred this talk. And that's my background. I should also say that I used to work on a dual diagnosis floor in a psych hospital as a nurse's aide. That was my college job. So I wasn't totally naive to how it can look. It can look to work with this population. Okay. Technical difficulties. It wouldn't be a presentation without them, you know? Okay. So yes, I am a naturopathic doctor. I've worked here for 6 years. I primarily specialize in hormones, but I also work with autism, ADHD, that sort of thing. First, I wanted to, speak to, you guys are here, but we're also going to be live. And everybody's coming here with a different purpose of understanding this. Some people might be going through a similar situation that I had with a loved one. Some people might have some addiction issues themselves, and they are curious about different options. So I tried to make this fairly broad and accessible to everybody. I also want to say, the typical route of substance use disorders in today's society looks like going to inpatient, and this is, of course there's a whole spectrum of what addiction looks like. I mean, I could say that I'm addicted to coffee, I am. I'm addicted to, chocolate, but, we're talking more about whenever it really impacts someone's life in a really significant way. So it starts with going to inpatient residential detox, and I do think that right now is the best option if you're severe enough, because you really need to be held in a very strong container. So I strongly support that. Medical assisted treatment is whenever you use different medications to help manage cravings, or actually help, they actually cause you to get sick if you were to use some of the substances. I wanted to say, a lot of our population is very holistically minded and have an aversion towards medications. What I'll say is this is a time when I think medications the benefit far outweighs the risk in general. So I often think this is a great option for a lot of people. There's the AA, Alcoholics Anonymous, Narcotics Anonymous, and many other support systems similar to that. AA is by far the biggest one, though. It's a very developed system. You don't need to recreate the wheel a lot of the time, and that is a very helpful resource to tap into. And then, of course, there's counseling and therapy, and I also think that's incredibly helpful. So I share all that to say that is the standard of what is out there, and I think all of those are wonderful options. And what I want to talk about today is what I see as actually a gap in all of these options. And that is actually the attention and the focus on understanding someone's physiology, and the focus on understanding some of the underpinning brain patterns that can cause these behaviors, and also potentially some natural approaches that can kind of actually help rebalance the system. So in the United States right now, I don't think I have to tell most people that there is actually an epidemic that is happening. 46 million people have substance use disorder and actually sought treatment. So that's the number of people who sought treatment in 2002. If you look here, in 2022, there are 109,000 deaths from overdose. That's a huge spike from, in 2000, there were only 17,000. So 17,000 to over 100,000 in 20 years. It shows that there's a lot of things shifting. And there's a lot of reasons for that spike. Some of it is just actually the drugs that have come on the market are a lot more lethal, primarily fentanyl, and is the big one that most people are aware of. But also, addiction actually has become more prominent too. And there's different reasons why that might be. Some people would say that, there's an increase in economic stressors, in social isolation. We're not as connected as a community like we used to be. Cultural norms, it's also become a little bit more accepted to talk about these things and to experiment with these things, I should say. And other variables are, obviously biologic, and vulnerabilities play a big role. And then chronic stress and trauma also contribute. So, in general, they've found that childhood trauma increases the risk of IV drug use by 4,600%. So it's a huge, huge increase, and something that really people need to look at. So what basically happens is whenever there's trauma, especially chronic trauma, that dysregulates your HPA axis, which is basically your hormones. Your hormones go out of whack. Your cortisol goes up, your adrenaline goes up, and And what that actually does is it causes a hypersensitivity of a part of your brain called the amygdala. The amygdala is kind of like your emotional center. And so what happens then is your emotional center gets too big, and then that causes a depression of your dopamine pathways. Another way to say that is your prefrontal cortex. I wish I should put that over there. But it actually suppresses your prefrontal cortex, which is the part of your brain that actually has to deal with decision making, planning and organizing, impulse control, working memory. So basically how to adult, you know? So if your amygdala is too high, that really inhibits your ability to quote unquote adult properly. And these two parts of the brain, they work like a seesaw. So if the amygdala is too big, it suppresses the prefrontal cortex. And actually the opposite is true too. If the prefrontal cortex is too strong, it suppresses the amygdala and the ability to have emotions, basically. Or I should say to be more emotional. So looking at these two parts of the brain are, I think, a very important component of understanding and actually having compassion for people with addiction, knowing that to some level you can't willpower your way into a healthier brain as much as you might want to. One thing that actually lowers dopamine as well is inflammation. So they actually show that it goes both ways. So early life inflammation. So to me that means like if you let's say grew up a little atypical, that you're a little bit more prone to having neural inflammation, or in the context of this practice, let's say you have Lyme, let's say you have Borrelia, let's say you have food allergies. So different things that cause inflammation in the brain, that actually can increase your risk of addiction by hypersensitizing your amygdala. Also, it shows that substance use can actually cause inflammation. So that's one of the ways in which it changes the brain. So it potentiates, if there could have been already an underlying weakness, but then the substance actually causes more inflammation and potentiates the issue and makes it worse. So deficiencies in dopamine look like addiction, fatigue, sleep disturbances, low self-esteem, difficulty concentrating, procrastinating, social withdrawal. So this is what happens whenever there's too much inflammation in the brain for a lot of people. So this is a really important concept, because when we think about addiction, I think the most common thing that people think about is, if you use a substance long enough, you develop what's called a chemical dependence on it. So chemical dependence is very different than salience. So salience, you could try a substance one time, and that substance makes you feel like all of those challenges of feeling unsafe, having anxiety, maybe depression, it just corrects those imbalances and makes you feel normal. It makes you feel safe. It makes you feel good potentially for the first time in your life. It actually turns off your fight or flight. And then all of a sudden, the substance that causes you to feel that way becomes of the utmost importance, because your brain interprets the need for that substance for survival. So even though you might logically know this is actually going to kill me, it actually is perceived as this is imperative to my survival. And so you become hyper-focused on it. It completely changes the way you think about things and changes your priorities. That's different than chemical dependence. So chemical dependence usually actually does have to do with it's pretty directly related to how long you're using something. So typically you use something for 4 weeks is the average amount of time for your brain to actually change and down-regulate your own production of certain neurotransmitters, such as dopamine, such as norepinephrine. And so then whenever you don't have it, you go through a withdrawal, and you start having what we classically think of as like a substance withdrawal. But that is a different thing than salience. You can have both of them together, and that's whenever it gets really tricky, is whenever you not only get sick if you don't have that substance, but now you perceive a threat to your survival because you don't have that substance. So if inflammation causes a decrease in dopamine, which makes you more prone to addiction, could the reverse be true? Can a decrease in inflammation support addiction recovery? I think that's kind of the next logical question. And it would appear so, actually. So it did some, I'm just going to talk about my 3 faith. I actually feel like for no matter what talk I do, whether it be hormones, ADHD, or whatever, I come back to the 3 supplements that just have so much research supporting them in so many different ways. And one of them is NAC. So NAC, it actually supports the production of something called glutathione. And glutathione is very helpful for many things, but one thing it does is it actually decreases the inflammation in your body and in your brain. And whenever they actually did a meta-analysis to see if NAC helped with drug addiction, they looked at 16 different trials, looking at a whole range of things. Looked at nicotine, cocaine, amphetamines, cannabis, and alcohol. And it showed that across the board, it showed a significant decrease in craving symptoms whenever you compared the NAC group compared to the placebo group. It also showed that it likely decreases any withdrawal symptoms, and it also helps alleviate depressive episodes from the withdrawal episode symptoms. They also showed that just by taking it alone, it helped decrease the amount of smoking nicotine. That was a nicotine research. Just the amount of cigarettes people wanted a day, which I thought was really interesting. So the reason why I highlight this is because this is such a safe supplement that no matter where you are, there's a very good chance that this could be a potential option. And so whenever we're giving a talk, I can't go into the nuance of each individual substance because a lot of the times it can actually be dangerous to give too detailed of information. But NAC is something I'm confident in saying is likely could really make a big difference. And I want to say something too, I think that there's this thought that, natural medicine is really good for supporting people, but when things get really serious, you got to go to the big guns. You got to go to the medication, more conventional treatments. And I don't necessarily think that's true. I actually think that a lot of times when things are serious, especially if they are chronic, which substance use disorders are chronic, just like mental health disorders are chronic, really trying to nourish the body, nourish the brain from a more foundational level is going to actually be more helpful in the long run. Anecdotally, I have seen NAC be such a simple thing in high doses, extremely beneficial for pulling people out of some really tough psychological places. So it works. Fish oil. Fish oil, I think, is like a water hose to a brain that has a ton of inflammation in it. Just today, Dave had a patient with concussion. We were like, "Where's the fish oil?" And this is also true in whenever people are having trouble with substance use disorders. So these studies were mainly done on rats. That's the only way that you can really look at the effects of these things on the brain, because unfortunately they have to sacrifice and then look at the brain itself. But it showed that by doing high-dose fish oil, it actually protected the brain and the liver by 90% for the high-dose alcohol consumption in rats, which I thought was just amazing, So it's like, even if someone's not in a place where they're willing to give up drinking, there are ways that you can actually support yourself and protect yourself from the damage that these substances can do. And that might be the best way to really support and love someone, is just say, okay, I know you're not there yet, but maybe try taking some fish oil. It also helps modulate the dopamine pathway. So, of course, that dopamine deficiency is often what really causes someone to be very vulnerable for addiction. And so the research actually said that it goes both ways. If dopamine's too high, that causes psychosis. And so it actually can downregulate dopamine in that time. But whenever it's too low, that's whenever you see more addictive qualities a lot of the time. So I thought that was really fascinating, that it can actually do both. It can lower it and it can increase it. And I also say that's the power of natural medicine that you don't see in something that's synthetically made in a lab. Something that's made in a lab doesn't have the flexibility to both increase or decrease something so that it's actually brought into homeostasis and regulation. They also showed that fish oil was very successful at alleviating anxiety-induced opiate behaviors. And this was in rats, but they said that it translates human behaviors and pathways. And so basically, if they had two different studies, and the rats that had access to fish oil were using more fish oil, whenever there was an opiate taken away, they didn't show the same signs of anxiety and basically panic that the other rats did, which I thought was really interesting. I love ashwagandha. It is just such a good tried and true herb, and it's so easily accessible. You could grow it here in Pennsylvania, and the roots are really what you use. Ashwagandha is an adaptogen, and so adaptogens are herbs that help you adapt to stress. They also protect the liver, and they help modulate your cortisol response whenever you have something that's stressful. So they actually showed that which one do I want to talk about? There were a couple ones I thought were interesting. Oh, they actually showed that ashwagandha and brahmi, which is another herb, also called bacopa, that's commonly used, were as effective as diazepam at decreasing alcohol withdrawal symptoms, which I thought was pretty cool, because alcohol withdrawal can be pretty harsh. It can cause seizures. It can actually be life-threatening, and usually it has to be done under medical supervision. And they showed that this was as effective as diazepam, which is the main drug that's used to kind of manage those withdrawal symptoms. It also showed that if you gave ashwagandha to rats while they were using opiates, it actually prevented them from building tolerance. So one of the ways in which opiates are really dangerous is because once you have one dose, that dose doesn't do much for you anymore. You have to keep increasing the dose higher and higher and higher to actually get the same effect and to actually feel normal again. And they showed that in rats, it actually kept them from building tolerance, so they could use the same dose over and over and over again and have the same effect, which made it extremely less dangerous, which was really interesting. So in my head, I'm like, okay, could we go down to Kensington Square in Philadelphia and just hand out bundles of ashwagandha? Will I get arrested if I do that? I don't know, but I kind of want to. Let's see. The top one was a really interesting study. I don't know how they determined this in rats, but they actually showed that if you gave ashwagandha to rats that were dependent, chemically dependent on alcohol, and then you took away the alcohol and then presented it later on, the rats that had been taking ashwagandha wouldn't go for the alcohol again. So it actually prevented relapse in rats, which I thought was fascinating. So once again, ashwagandha is such a safe herb. You can give it, it's been used for thousands of years for babies who are failure to thrive. So it's a safe herb for the most vulnerable of humans, and it's still incredibly potent and powerful. Other things that are really helpful to have on board are, magnesium. Magnesium is important for a ton. I couldn't tell you the number. I feel like you could probably tell me the number of pathways in the liver. But if you don't have enough magnesium, your liver can't really function at its optimal capacity. So like having magnesium on board helps with liver. It also helps with calming the brain so that you're not as anxious, and it also can help with tremors and that sort of thing. Passion flower is a anxiolytic herb, and it was actually shown to be as effective as clonidine in opiate withdrawal. And so clonidine is often like just a common medication used to help people as they're coming off of opiates. And yeah, it was shown to be as effective with the withdrawal symptoms themselves, but it also was shown to be superior in overall mental health support of those people, which I thought was really interesting. B vitamins are very well established in their importance in helping people recover from addiction. There's even a condition called Wernicke-Korsakoff syndrome, which is from a B1 deficiency, because whenever you are using a lot of alcohol, you really deplete yourself in B1, and then that can cause a whole slew of mental health disorders because you don't have the proper B vitamins just to function properly. And this is something that's really easy to get. You can just get a B complex, and all the different B vitamins play a role in supporting neurotransmitter health and overall health. So beyond the supplements, and honestly I should say, I kept that part very narrow with things that have a lot of research and are very safe. You can get a lot more detailed with saying, okay, this substance really benefits from this herb, but I didn't go into that because I think it's really beneficial to work with a professional on that if you're looking to use it in that context. Other things, so this is actually a picture of the inside of Holistic House, which is our sober living home. We have a gym in the house, and we really try to support the guys to create healthy habits. So one thing we do is we go down once a week and we give a 15-minute lecture on a health topic of some kind, and the guys love it. They really want that information. They really enjoy it. And probably the biggest thing we're trying to drive home is exercise, specifically strength training, because we really believe, and the research supports, that basically the stronger the body, the stronger the mind. And so whenever you're trying to change who you are, which is probably the hardest thing a person can do, there's very few things that are as potent as actually changing your physical appearance and strength. It helps regulate the dopamine pathway. So most of the things that are out there to help support addiction, whether it be AA or counseling or even like detox centers, they're trying to increase resiliency and white knuckling it, but the cravings are still there. Whenever you actually address the physiology, change, your strength, you actually can help regulate your dopamine pathway so that the cravings aren't as intense, which I think is super important. Faith-based support. So they've actually shown, 73% of all addiction treatments incorporate a faith-based component. And the reason why is because it's more effective, and they've shown that over and over and over again. So I think that's really interesting and not to be minimized either. There's very few things that can shift someone's internal world as much as I think incorporating a spiritual practice. Mindfulness and meditation. So mindfulness is really about stopping, becoming aware of how you feel, so that you can move through life with a level of awareness, basically, and not just be driven and being reactive. So that's kind of the idea of what mindfulness is underneath. So the reason why this is often very helpful is, so cravings usually only last 15 to 30 minutes in general. So if you can have the mindfulness to say, okay, I am having a craving right now, I want to go use something, and you are able to name what emotion could be driving that craving, and then use different techniques like breathing and meditation to help regulate your nervous system for 15 minutes, often that craving will pass. And I think, that is a really important piece that often isn't really taught in a lot of recovery centers. Sound healing and breath work. So we actually have a friend who struggled with heroin addiction for a long time, and he told me one time, and I thought this was so interesting, he goes to AA and NA, that's his community, but that's not where he found his healing. The first thing that gave him, I guess, that salience that I was mentioning, that wasn't a substance, was sound healing. It was these really powerful gongs that just really vibrated his system, and for the first time he felt like his brain stopped and he felt okay. So this is just one example. There's 1,000 examples of different modalities that can be brought in to that kind of help balance the nervous system in a really helpful, healthful way. Breathwork encompasses a lot of different things. It can be as simple as just becoming aware of your breath, or it can be over-breathing, where you start actually really changing your physiology because your oxygen and carbon dioxide levels in your body get shifted, and that changes your neurochemistry. So there's a lot you can do with breath, and if you have someone who is trained in that, they can guide you through that, and that can be extremely transformative. I used to teach breath work. I kind of just haven't done it in a long time. I actually just did it for our guys this past weekend, or 2 weekends ago, which was hilarious. One of the guys loved it. The other guys looked at me like I was crazy. But once we were done, they were really actually very engaged and were very interested, and they were like, what is that? We've never done anything like that before. And they wanted to understand why I was making them do this. And then they said, well, maybe next week I'll do that. You just should have explained why we were doing this first. I thought that was really funny. But I'll say, in my years of teaching breath work, I probably had at least one person in each class come up to me afterwards and say, that was more effective than 20 years of counseling. That was more effective than anything because it actually changes your brain like very few things do. I felt like I couldn't not talk about this. This is happening. It's not a far out thought to think that we're actually going to have medically assisted psychedelic experiences as a primary role in with helping with healing from addiction recovery. I should say healing from addiction. Even U.S. UPMC here in Pennsylvania offers ketamine therapy. So ketamine, it is primarily used to anesthetize children, but whenever you do really small doses of it, it actually can cause this like psychedelic experience that is completely life-changing for a lot of people. And sometimes people need to get out of their physical experience to have a big enough shift and change that they can make better decisions for themselves. So that's actively already happening for mental health in Pennsylvania, and then in different places over the like throughout the United States, they are using it for addiction. They use ketamine is the most common and well-researched one. Ibogaine is one that comes out of Africa, and that's becoming popular. And there are other ones too, and even Johns Hopkins has done some of the leading research on this. So one thing that we're really starting to gain a really strong understanding of is, isolation is a huge, huge factor for people with addiction. And what, commonly happens is whenever you are struggling with that, you do get isolated from your family, from your loved ones. And it's hard to have compassion for this population a lot of the time. And often family members are not the ones who are able to provide it. And so, that's why being in a community of people, whether that be through like AA or NA, is of the utmost importance, because it's really almost impossible to do it on your own. You have to have a community of people who understand you and still have compassion for you. Let's see what else. Yeah, basically it all comes down to addiction is not about a substance. It's not about a drug. It's about pain. It's about pain, emotional pain, often, that drives the need for a feeling of okayness. It's really not about having even pleasure or reward. It's about a feeling of okayness that people are really seeking a lot of the time. I just put this in last minute. I only talked about things that are relatively inexpensive and accessible, but NAD is not one of those things, but it actually has a lot of really good anecdotal support in being used for addiction and decreasing cravings. NAD is a derivative of B3, and it's infused through an IV, and for some people, they've used it once and had a complete cessation of their cravings, and the thought is that it actually heals the underlying almost depletion that was driving a lot of those behaviors in the first place. So there's things like this that are out there as well. It's just a little bit harder because these are not really offered in treatment settings at all. It's really hard to address addiction in an outpatient setting. So we offer it here, but we don't treat addiction here because we don't have a strong enough container to hold people in a safe way who are going through the throes of severe addiction. But it could be a very viable option for people who are more functioning, whether like a functioning alcoholic, who are still carrying on with their daily life, but are trying to figure out different routes to go to help with their substance use. So the last thing I was going to say, I imagine that probably the people who would be here would be the people who have loved ones with addiction. And it's worth mentioning that if that is you, there's very few things in this world that are more stressful, more heartbreaking than that. And it's really important that you take care of yourself. It's really important to set healthy boundaries, practice self-care, seek support from other people who understand what you're going through. So Al-Anon is for the families of people with addiction. There are other programs like that. It's really, really helpful to go to those sorts of things. Educate yourself about addiction and really understand what it's about. It's not a character flaw. You don't need to try to fix them necessarily. You don't need to try to fix them. It's if you understand that it really is a disease, it allows you to have more compassion for them. That's the last thing, compassion without enabling. And also that helps you navigate where to have boundaries, where not to help, and where to help, basically. And also consider therapy. And that's it. So thank you for coming. I appreciate you guys coming to learn about this a bit more. I hope you found it helpful. I can take any questions you guys may have.